this pandemic. Planned Parenthood will not have access to the new multi-billion-dollar funds that are meant to stabilize the U.S. economy. Trump's Small Business Administration will be able to deny Planned Parenthood access to emergency rescue loans, which for other nonprofits and small businesses are available. This bill also includes language that blocks state and local governments from using coronavirus rescue funds to be allocated to cover abortion services. And this links directly to what's called the Hyde Amendment, which most of you probably have heard of. It mirrors the same language, which bars the use of federal funds to pay for abortion. It's just another tactic to block access and make reproductive health care and abortion care inaccessible and unattainable for people. The Small Business Authority will be in charge of overseeing this massive $350 billion lending program aimed at helping a wide variety of small-time operations across the country meet things like their payroll and their rent. But it also gives Trump's Small Business Administration leeway to decide which organizations and nonprofits qualify and which don't. So we know that Planned Parenthood, because we are an abortion provider, will most likely, if not certainly, not be a qualifying organization. Ultimately, this bill does offer financial support for small businesses, nonprofits, working everyday Americans. However, during negotiations to pass this, as I said, Planned Parenthood has been blocked as a recipient, which is a really challenging thing for us. Another thing we're seeing across the nation is that states and governors across the country are using this as an opportunity to restrict our bodily autonomy by deeming abortion as a non-essential procedure. That means that when businesses are told to close if they don't provide essential services, that includes abortion clinics, and that includes Planned Parenthoods. We're seeing that in states like Texas, Ohio, Louisiana, Mississippi, Alabama, and Iowa. And we know that's not true about abortion care. Abortion is reproductive health care that every individual deserves. It's a time-sensitive thing, and it impacts a person's life, health, and well-being. Another thing that's been challenging is that access to birth control, we know, is even more critical now than ever. But not every state allows for a patient to get 12 months birth control access or to have consultations about birth control via telemedicine. It requires them to go into a health center or into a clinic to receive this. And 18 states have effectively banned access to telemedicine. So that for people, especially in rural areas that can't drive to a pharmacy or to a doctor's office, this really restricts their access to reproductive care and to receiving birth control. But with all these negative things said, Planned Parenthood and the ACLU National have worked together and are working with other partners and are suing the Trump administration and our federal government for restricting access to reproductive health care. They have sued in Texas, Ohio, and Alabama already, and we've already seen some successes. So in Ohio, a district court sided with Planned Parenthood and other groups, and the state's ban for opening abortion clinics and keeping them open has been put on a 2-week temporary restraining order, which is a good start and allows us to continue to fight. In Alabama, the district court judge ordered the suspension of the state's abortion ban until he can hear our arguments in a video conference on April 6th. And then lastly, in Texas, this was a challenging one. Initially, the district court sided with the abortion clinics and granted a temporary restraining order. But as of this Tuesday, a federal appeals court temporarily has allowed Texas to continue to ban abortion during this time. And we're already seeing the impacts, which I'll talk about a little bit later, but we're already seeing the impacts on our health centers at Planned Parenthood of the Rocky Mountains. Just in the last few weeks, we've already started to see patients from Texas driving to Colorado because this is the only place that's close to them that they can access care. So it's even more important that we in Colorado keep our doors open and continue to be our safe haven state. So I know you all are here to learn what is happening in Colorado and what the status is on reproductive health care and abortion care here in our own state. And I have good news. Our doors are still open and our health centers continue to serve our patients and providing them expert reproductive health care every day. So a huge thank you to the health center staff who continue to go into the office and into our health centers to make sure those are running and working with our patients. And another reason this is possible is because our teams have been working very closely with Governor Polis, who has offered a directive affirming that abortion is essential health care. So we don't have to be concerned that he's going to ban this or that he's going to deem it as unessential. Organizations and groups like the National Abortion Fund and the Women's Freedom Fund are still providing funding for abortions as usual, and non-Planned Parenthood providers are still open and providing reproductive care, including abortion. So overall, we're in a pretty good place in Colorado. We're continuing to assess daily, and we're working to take precautions to make sure that our staff in the health centers and our patients are safe and that they're protected. I'm going to dive in a little bit on how we're working, some of the changes we've made in our health centers to protect our patients and our staff. We're first prioritizing urgent, time-sensitive healthcare issues such as STI testing and treatment, UTIs, and abortion care. We're also reorganizing our operations to minimize the time a patient spends in the health center and the contact they have with other patients and other staff in the office. We're expanding remote interactions and limiting time a patient spends directly in the health center. And we're doing this by continuing to offer and expand telemedicine. And then lastly, with our PP Direct app, this is a really great app that allows you to access and have consultations about birth control and get a UTI prescription right from your phone by talking to one of our providers from your app. And I've used it and it takes less than 30 minutes to get a response and to get a prescription, which is amazing. I'd like to dive in a little bit about our telehealth, which is really amazing. And one of the reasons this is great is because, especially for folks in remote areas, this is a way that they can still access care without having to drive to a Denver metro area. We've been using telemedicine in our region at Planned Parenthood of the Rocky Mountains since 2017, so this is not too new to us, but we are working to build it out and expand it in this time. We offer family planning and medication abortion services over telehealth, which, as we have heard, is not the case and not an option in every state. We're rapidly moving aspects of our traditional patient visits to a remote virtual workflow to reduce physical touch points and reduce the time in a health center. And we have a robust birth control mail program where we send patients their birth control by mail. And because of some legislation last legislative cycle, patients are now able to access a full 12 months of birth control at a time, rather than having to do this every single month. We're also expanding this model to certain therapeutic prescriptions. For example, if you need treatment for chlamydia, you'll be able to talk to a doctor via telemedicine and get access to the treatment that way. And then our centralized follow-up team helps to manage patient care for our patients, including contacting patients with their test results and writing treatment plans via remote means as opposed to them coming into the office. So in Colorado, we're really ahead of the game and we're working to continue that and grow on it. One of the great things that I was reading about is our Attorney General in Colorado, Phil Weiser, has joined on to a coalition of 21 other attorneys general, urging the federal government to lift restrictions on telemedicine so that women can access mifepristone, which is the first drug in a medication abortion, without having to go into a medical facility. They'll be able to get it through telemedicine. This could really change the way things are accessed for patients across the country. And it's great to see one of our elected officials from Colorado leading on this. I just want to close and say that we are not only keeping our doors open for Colorado, but again, we are a safe haven for patients all over the country and especially in our neighboring states. That's it. And I will turn it over to Cass, who's going to dive in about what the stay-at-home order means and a little bit more about how the ACLU is working to protect access and in this fight.
Thank you, Ariana. So what exactly does a stay-at-home ordinance mean, right? So definitely means that you should stay at home as much as possible, except for critical activities. And we're going to talk a little bit about what those activities include. So, for example, obtaining food and or other household necessities, including medicine, going to and from work if you are a critical/essential employee, seeking medical care. The one thing I do want to flag when it comes to seeking medical care is that some hospitals have implemented a visitor policy, and this can really change someone's experience at the hospital if you are going in to have access to reproductive health care services, right? So if you are going into labor, if you are seeking perhaps a surgical abortion, it could change your whole experience in the hospital. So what we recommend doing is calling ahead if you can, and or just looking on the website. I know right now a lot of hospitals have posted their visitor policy on the website, but if it's not there, we definitely recommend you calling. According to some Colorado birth justice advocates, for example, one of them being Elephant Circle, they have not heard of any hospitals banning from people from visiting, but they are saying that they're seeing that folks at the hospital are only allowing one person per visitor, like for you to be there. There's also a little bit of talk around doula care. So doulas, if they are hired through the hospital, then they are allowed to be there with their with the person that they're helping. But if they're not, then unfortunately they're not there. They're not allowed to be there. If you have any questions regarding the hospital that you might go to, or somebody has a question about the hospital that they need to go to, you can always reach out to us and we can help you review the policy. Or you can always just go and reach out to Elephant Circle. We'll make sure to include them as a resource in the follow-up email. So obviously you can go out if you need to care for your dependents or your pets, if you're caring for a vulnerable person in a different location. And lastly, this one's really important, just because Colorado is a super active state. You are allowed to go outdoors for recreational activity, but they are suggesting that you stay within your neighborhood area and to stay a safe distance of 6 feet or more from other parties. And so who's considered an essential worker, right? So on the left, we have a long list of examples of who's considered an essential worker. I'll just name a few. Folks who work in grocery stores, banks, pharmacies. We know that a lot of bars and restaurants are closed, but Some of them, most of them are still doing takeout and delivery only. Post offices are open. Hospitals, clinics, and healthcare operations are still open. Folks who work in the public benefits arena, they're still open. Pet supply stores and veterinary services are still opened. And obviously all the things on the right are the things that are currently shut down. And so what does this mean when we're talking about engaging with law enforcement, right? Are police going to be enforcing a stay-at-home ordinance? So technically, no. However, this is an executive order, and not following this order is considered breaking the law. There has been questions around whether the National Guard will be enforcing this order, and they're not. They're here in our state supporting logistics, transportation, and helping with medical response efforts. Residents who suspect that someone is violating the order should first contact their local public health agency to report any concerns. And obviously, if you were to be pulled over by the police, make sure that you're looking for that siren, badge, and license plate number. There have been a couple of incidents where folks have reported being pulled over by someone impersonating an officer. If this is the case, we highly suggest to just be super careful if you are in this situation, and then calling 911 as safely as possible. I know that some businesses are giving out what I guess you can call an essential worker letter, or like a permit saying that you are an essential worker and therefore you can or need to be out and about. This isn't something that every business is doing, but I would suggest, if this would make you more comfortable when navigating from point A to point B, to talk to your supervisor or manager and see if you can have access to something like that. So now I'm going to talk a little bit about some of the jail work that we've been doing during COVID and how it's been affecting folks in jail, and then some of the work and resources that we've been doing and we have for undocumented communities. So on March 17th, the ACLU, along with other advocates, sent a letter to the governor urging immediate action to address the heightened risk of COVID spreading to incarcerated individuals, correctional staff, and ultimately the public. Then about 5 days later, an infectious disease expert also sent a letter to policymakers stating his concern about the spread of COVID in jails and prisons. So we were doing all of this advocacy from this side, and then we also sent out a giant, sorry, had a blinking moment. We sent out an action alert where community filled it out and it got sent to Polis. And then on the 24th, Polis issued a guidance to counties, municipalities, law enforcement agencies, and detention centers, urging them to follow the guidance so then we could reduce the possibility of folks contracting COVID. And then just yesterday, the Denver Post wrote an article stating that Colorado has had the biggest jail drop population by 1/3 as sheriffs combat spread of COVID. So essentially, the rates dropped from 11,000 to 7,000, and that hasn't happened in an extremely long time. I can also link that article in there so you all can read it. This is obviously done through all of you, through the advocates that work in the community every day. But really we put the pressure on, and this is the outcome that we got. Through this, we've also learned that jails are prioritizing the release of pregnant people. If you hear that your county jail is not following this, or is not releasing or prioritizing the release of pregnant individuals, you can always reach out to us and we'll help you with that. Let me see. And then, so what does this mean when we're talking about undocumented communities, right? Like, how does it affect them? So if you want to learn more before I dive in, I'm also going to ask you to join us next Thursday for a Know Your Rights, Immigrants' Rights with COVID webinar, and that'll be at 6:30. We'll also send that link. But for right now, we're also asking folks to just listen to the stay-at-home order. If they do not speak English, they can always download a letter, which is linked here, stating that they are out for an essential task. This letter is Spanish and English, and it basically just says, like, I'm out for an essential task, and if you have any further questions, like, here's somebody that you can call who can communicate with you in English. If medical assistance is needed, we're asking folks to please seek it out, as ICE is honoring healthcare facilities as safe spaces. Casa de Paz also continues to house people that need somewhere to stay and provide financial assistance to buy a bus or a train ticket for transport. And then individuals with certain work permits are eligible for unemployment in Colorado. And then for those folks who are DACA eligible to receive the stimulus check, individuals who have DACA, some of them are eligible to receive the stimulus check, and it will not be counted against them as a public charge. And so this is just kind of like a snippet of the resources that we've put together. We'll be attaching a giant Excel sheet with all of these resources, and everything is in English and Spanish. And like I mentioned, if you want to do a dive deep and learn more in depth about this, you can always tune in next week for our Know Your Rights training. And that's all we have. I kind of went through my things a little bit faster. I'm a little nervous. This is the first time I am social with folks in 3 weeks, so there's a lot of you on tonight. But out of all the resources that I listed, or anything that is linked, it will all be in that follow-up email that we share out with you all. We will also be sharing out this webinar with you all since it's pre-recorded. And then we will also be sharing out the webinar that we had on jails and COVID earlier this week in that email as well. So then, you know, if you want to learn more about that, you can always learn about it.
Thanks, Cass. And we've received some questions, so I want to make sure we get to those and we answer them. A great point from Katie. Oh, oops, sorry, the thing is moving too quick. A great point from Robin, I'm sorry. Also wanted to mention that the majority of community mental health organizations are open and serving their communities. Most have moved as many services to TELUS services, but someone needing mental health care can still access it. That's super valuable and helpful information, so thank you for adding that. Another question I want to read off is, since abortions are a small fraction of PP's total work, are we still providing other services? And the answer is yes. So a patient can definitely come into our health centers for other services they may need. They likely can get those services or find a way to receive those services through telemedicine or remote options with our providers, especially if it's for birth control or UTI treatment. They can use our PP Direct app, so they don't have to go into our health centers, but we are still providing other services besides abortions. And in the follow-up email that we send, we will give some information about how you would schedule an appointment with Planned Parenthood. But again, we are prioritizing time-sensitive healthcare, such as STI testing and treatment and abortions. The next question is, will it be a possibility in the future for people seeking our Colorado telemedicine care to have that in their own states? That is a great question. Not every state is allowed to use telemedicine. So 18 states ban it and don't allow telemedicine, but hopefully, as I've mentioned, 21 attorneys general have signed on to ask the federal government to allow some leeway in this time. And this could be an option in other states if they decide to pass legislation to allow it in the future. Are only non-essential states allowing telemedicine? It really depends on their laws in the state. Are any of the non-essential states allowing telemedicine? I am not up to date and I would not be able to tell you exactly the states that are offering telemedicine, but I can add that in the notes and we can follow up with you after this. And someone mentioned that the Aspen Point Crisis Center is still open 24/7. Thank you, Autumn, for flagging that. There's another question about why we don't think Planned Parenthood will be receiving any of the benefits. So Trump's Small Business Administration is allowed to decide and talk about, they're allowed to decide which nonprofits and which businesses will receive financial protections and be able to opt into these grants because of the partisan makeup and the anti-Planned Parenthood and anti-abortion sentiment that's in our nation. We don't believe that we would be able to access that. Cass, do you want to share a little bit about ways to get involved at this time?
So my number one ask would be to do your census if you haven't done it already. And Ariana, I know that you all have an event coming up. It's a text bank, so I'll let you talk a little bit about that. But as of right now, I would say to definitely follow us on social media. ACLU/co.org is our website. Follow us so you can stay up to date with all of the action alerts that we are sending. And if you can, always donate. But if you can't donate, then donate your time, right? Like learning information. So joining us for our next webinar, which is actually next Tuesday, not next Thursday. And that one is COVID-19 resources for immigrants. So stay informed because the more we learn, the more we share out, right? So it can be any of those ways.
Great. And then as for Planned Parenthood, on the screen, you'll see a census at home text bank. That's happening tomorrow. It's an ask that we are going to be texting you some information. You can reach out to your friends, your network, and remind them to fill out the census and complete our pledge to count. You will be sending that information out tomorrow at 2 p.m. if you are CP for this. But of course, there's some leeway and you can fulfill that organizing ask in your own time whenever really works for you. We also will be doing a series of census education webinars. The dates are coming, so please look out on our Facebook at Planned Parenthood of the Rocky Mountains. And then for both of our organizations, just keep an eye out as we continue to roll out new trainings, new webinars, new options for involvement. We have our contact information on the next page, so would love to chat if you have other things in mind. And then, of course, if you're able to at this time, any way you can donate to us, that would be greatly appreciated as well. For Planned Parenthood, all that would be going directly to our health centers to make sure we can keep that open.
Okay, so if there's any other questions, now would be the time to ask them before we close out for the night. There was a question, Ariana, I saw about the PPE at Planned Parenthood. Are you all stocked for that? Do you feel good about your resources there?
Our health center managers and our security team are working really closely to figure out the best ways to protect our health center staff. I will find out if there are any specific needs and let you know if there's anything people could donate or ways to help out in that effort as well.
Great. I know there's a lot of concern in our community about making sure our healthcare workers are protected as they are on the front line of this fight right now. Oh, and we have another question. Do you see that question, Ariana?
Yeah. What percentage of staff are quarantined right now? So I can speak for Planned Parenthood, and Cass, you can add on for the ACLU. For Planned Parenthood, we have received guidance that it's best to have as limited staff as possible in the office. So any staff that can work from home or our admin staff are doing so at this time. Again, a huge thank you and gratitude to all of our health center staff who are still continuing to go into the health centers. But our health centers are safe, and I received information that we are good on supplies. But again, thank you to our health center staff. They are doing amazing work.
And as for our office, we are all working from home with the exception of some of us who need to go in for certain like administrative duties. But we have been working from home now for, I think, going now on like 3 weeks. And we will continue to work from home until we receive a different notice to do otherwise.
And we have a question about folks who have just been recently released. If they're given resources so they don't immediately become homeless and can have access to food, or are the released folks the people who are generally temporarily jailed rather than longer term prisoners? And that is a question that I don't actually have an answer for, but there's someone in the audience who could answer that for us. So I'm going to see if she types out an answer here in a second. A lot of the folks that are being released are from jail, and they're what we call pre-trial, meaning they're still innocent. Because they haven't been found guilty yet. So usually they're just being held because they can't pay a bail or bond. There has been concerted efforts to make sure those folks are being released so that they're not homeless, that they're going someplace, usually with family or maybe friends that they can go with. So, and we can get more information on that, definitely.
Yes, if we don't have an answer right now, we will follow up with that question.
Our public policy director for the ACLU is actually listening in tonight, and she just asked me to repeat the question, and then she is going to give us the answer. So if you all bear with me for a second, I am going to do that. So Denise, the question was, for the released jailed people, if they've been jailed for a while, are there resources they're being given so they don't immediately become homeless and can have access to food? Or are the released folks just people who are generally temporarily jailed rather than long-term prisoners? So we'll ask Denise, we'll give her a second to answer that. And we are going to be doing these webinars, as Ariana and Cass mentioned, for the next few weeks until we feel like it's safe to have events again. and we feel like the community feels safe coming out. That might, we might get the all clear, but from the government, but some of you might not feel safe going out. You might not feel like it's a good time for you to go out yet, and we still want to provide these webinars and these resources for folks. And Lizzie has said there is also a huge effort to house all currently homeless people in our state. So thanks for pointing that out, Lizzie. And Denise, our public policy director at the ACLU, has answered that question from earlier, and she says those folks being released are largely individuals who are pretrial and have not been held for a long period of time. Indeed, they are there because they can't afford the money bond to get out. So, and at the ACLU, we have been working for years to reduce the amount of money bond that people have to pay. So this is right along with what we normally do. All right, let me see what other questions we have before we. And Ariana, the last question is for you, if you see it on the chat.
I do not.
It says, I'm not sure if it's actually a question that I think they want to know if PPRM is allowing employees to take paid or unpaid time off.
Yeah, so they, as far as I'm aware, I'm not in our HR department, of course. We are able to use sick time, we're able to take paid time off, and we are working with the federal guidelines on the expanded FMLA policy.
Great. All right. And I'm just going to give people another second or two to type in any questions that they may have. And all right. So any closings before we end tonight?
We just want to thank you all for taking time out of your evening. I know everyone's got a lot going on. There's a lot of webinars happening. You've got childcare and dinner plans. So thank you so much for joining us and learning with us. Again, our contact information for both me and Cass are here, and we will send all this out in the morning so that you can sign up for any of the follow-up events if you would like to do so.
And if there's anything that you didn't ask tonight that you're still processing, you can always email one of us asking that question. We'll be happy to help you and or direct you to the proper resources.
All right, well, I'm just trying to keep up with the chat. Thank you for all the kind words in the chat, and thank you all again for joining us, and we are going to go ahead and end the webinar. You all have a wonderful, wonderful evening, and we will, you can all join us on Tuesday. Thanks, everybody.
Thank you.